How how would most schizophrenia patients deal with what's going on currently with the pandemic, deal with the social isolation, deal with some of the anxiety that has hit, you know, everyone across the world?
So we see a lot of people with schizophrenia in this clinic. We have a very high percentage actually as a clinic, and it's varied, and it varies to some degree on what their symptoms tend to be anyway, because not all patients with schizophrenia have the same subset of symptoms, right? And some of them tend to isolate anyway. I have one individual in particular with schizophrenia who has fixed delusions. He had numerous relapses, and he's stable because he's not in jail and he's not writing letters to the judge and he's not violent. So that is stable for him. But he still maintains that he is presently being radioactively poisoned by an improperly disposed of X-ray machine. And so he tends to be very isolative anyway. He doesn't go out because when he goes out, he sees jet streams and thinks the military is following him and things like that. So he tends to isolate anyway. I recently saw him. He's not feeling much of anything related to the coronavirus pandemic and the social restrictions that go on. I have another individual, however, that is very paranoid, and we're struggling with increased paranoia, increased anxiety, that this is a government plot, that they're somehow targeting this person in particular by affecting the whole world so that this person won't think that it's just against them. And it's very irrational, very delusional, paranoid thinking. So I think that there are two extreme ends of the spectrum, and I think every patient with schizophrenia will probably have their own kind of unique thoughts about what this is all about and how it's affecting them, kind of based on what their lingering symptoms might be, if any. But a couple of my patients that are really usually pretty stable are in particularly having a difficult time with anxiety and sleep right now. Lots of worry about what's going to happen, kind of a thing. So not so much having symptoms of psychosis present, but exacerbating comorbid anxiety.
Okay, and how has this patient population taken to more telemedicine, virtual appointments, things of that nature?
Well, that depends on the patient with schizophrenia and their symptom subset as well. I have a couple that are still coming in to see me because they will not do a video visit, and they're reluctant even to only do a visit on the phone. Now, I will also say that not that big of a deal for many of my patients with schizophrenia, not even being for their psychiatric appointments not even being an issue because they get a long-acting injectable. And so far, we've not mastered a way to give that through the computer. So our patients that receive LAIs are still coming into the office for their face-to-face visits anyway, but it has impacted their therapy visits. And so some of them are not willing to do therapy at this point in time because they refuse to do something where they're going to be on camera.